Good evening, everyone. I'm Colonel Jeremy Bell, the Garrison Commander for Fort Campbell, and welcome to this evening's COVID Facebook Town Hall. So like last week's, very similar format. What we did is we took your input from last week, some of the questions that we didn't get to last week, and we've teed up a couple topics for you tonight. So we'll talk a little bit about face masks. That was on everybody's mind last week, so we'll give you a couple more updates there. We'll give you an update on Dodea and some of their most recent policy and procedural changes. Barber shops were on people's minds, so we'll talk that briefly. Bach will give an update on their current situation, and then we'll go over we'll kind of wrap up with some of the good news stories around Fort Campbell. So I'll start with introducing the panel this evening. To my left is Major General Brian Winsky, the Commanding General for Fort Campbell and the 101st. To his left is CSM Barker. And then we also have Patrick Birchfield off-site in another room, and we'll cut to him a couple times. So with that, sir, I'll throw it over to you for introductory remarks.
Well, hey, good evening, everyone. My name's Major General Brian Winsky, and I'm the commander of the 101st as well as Fort Campbell, and Command Sergeant Major Barker and I are here for, I believe this is our 5th or 6th weekly town hall on the COVID situation. So as we said from the very first one of these, and we've been consistent throughout, we want you to know what we know. We want you to know that every decision that we're making is informed by the advice of our best medical professionals, including our hospital commander, who's in a satellite room, Colonel Birchfield, our division surgeon, Colonel Thompson, and the entire Blanchfield 531st and division surgeon team. As you all know, DoD guidance is we're not going to convey very specific numbers as to how many active cases that we have, but I will share with you in general terms, it's a very manageable number at this point, around 24. And really about half of those are active duty service members, and then the other half are the other population that we track. Family members of service members, retirees, their family members, or members of our civilian workforce, whether it's contractors or DA civilians. Again, about half of those 24 cases or so are active duty military, and the good news is they're all recovering, and their bodies fighting this off, and they'll come out of this 14-day period or so clear of the virus and ready to return back to their duties. Some really good developments since last week, and very good developments since about 2 weeks ago, is the test time. We're now getting the test results back in about 2 days, which is a significant reduction than what we had initially, and the backlog is much better. We're down to typically about 30 or so tests that we're awaiting the results for, where it was quite larger numbers than that just a week and especially 2 weeks ago. So that is good news. The testing capability and the testing turnaround is going much quicker. When you think about our numbers, again, considering the entire population of all the active duty service members, their families, the retirees, their families, our civilian workforce, that's about 250,000 folks. So what we're talking about is 1 per 100,000 or so, which is pretty, again, very, very manageable. And it tells us that our fundamental discipline, the limiting things to essential movements, is keeping everything contained, and it's not spreading it, which is exactly what we needed to happen. None of our active duty service members required hospitalization, but one of our retirees did. And the good news is he too is recovering and is likely going to be released in the next day or two. And it was in an abundance of caution that he was hospitalized for just a few days. And again, it looks like he's going to be good to go and released here in the not too distant future. Around us, Tennessee's got about 5,800 cases. Montgomery County, which includes Clarksville, of course, has about 102 cases. Kentucky has 2,100 cases, and Christian County, Hopkinsville, and Oak Grove, about 70 cases. So again, the social distancing, the minimizing movements, not just on Fort Campbell, but our surrounding communities, has helped keep these total numbers of cases very, very manageable. The White House and the Center for Disease Control are keeping the social distance guidance through April at least. Governor Lee here in Tennessee has really mandated essential movement only guidance, and that's going to be the case for at least the next 2 to 3 weeks. And our standard remains a 50-mile bubble around Fort Campbell. All movements are to stay within that unless you have an approved exception to policy, and essential movements only. Talk about essential activities and essential movements. So, as we said up front, we want our soldiers to do PT every single day. That's part of their overall health and being cooped up, either at home or in barracks. That's one thing that we need to sustain and continue to do, and that's going well. Again, not in large formations, in small groups, but soldiers keeping themselves fit to fight and ready for worldwide deployment. We've put a lot more effort in the last couple of weeks on maintenance of aircraft and vehicles with very good results, and that's going to continue. So there is some essential activity related to maintenance of vehicles, weapons, aircraft that will continue and kind of ebb and flow in terms of the amount of that activity that's underway. Individual training tasks, I think, are going very well. Some units are doing a great job using some tools to do that in a distributed way and have some good products that soldiers are keeping their fundamental skills up without having to, again, converge and be in large groups. So, again, that's all going pretty well from our perspective. And then deployment support, and I'll talk about deployment developments here just this last week, where we've had some other elements of units from across Fort Campbell deploy in support of the nationwide response and fight against the COVID fight. Going forward, we have a number of deployments that are really not that far out. Our combat aviation brigades deploying to a number of locations in June and July. So in the immediate future here for the next couple of weeks, we're going to have some training things that they're going to have to do to be prepared for what awaits them in Korea, Afghanistan, and Europe, specifically gunnery. But we're doing it in a way where we're going to minimize concentration of forces and do it in as distributed manner that we can to minimize the risk of the soldiers involved. And again, all of our positive cases, none of them are related to contact with folks training or anything of that nature. They're all generally travel related, and it's contact with someone that generally traveled in a higher risk or a higher density area like New York, like Washington State, some of the other areas where there's just a much higher number of COVID positive cases. So again, training and preparing for deployments is going to be essential activity, and we're going to see more of that as we go forward with the CAB shooting a gunnery here in the next few weeks, and other deployment rotations, which as soon as we can are going to resume as well. And we were on the verge of rotating the task force in Africa with 3rd Brigade, so we're on call for that, and we anticipate that may happen in June, barring any major increase in number of cases or anything that would require us to hold off on that. Deployment update, the 531st, as you all know, is deployed in New York now, running the Javits Center Hospital, doing a great job. Our sustainment brigade just deployed a contingent this morning to New Jersey, Fort Dix, right across the river from New York, and they're going to help with sustainment across that region in the COVID fight. Our 3rd Brigade, as I said, they have a task force rotation that we're going to execute as soon as we can in Africa, and we just reinforced the Southwest Border Mission with about 250 soldiers about a week ago. And then 1st and 2nd Brigade are on a path to their Joint Readiness Training Center rotations in August, September. We're pretty confident this will be largely behind us at that point, and there's some preparatory things that they're going to have to do, and if the conditions allow it, that'll begin in June and July as well. And I mentioned our CAB deployment to a number of locations. Again, we are sticking with the original timeline where they deploy throughout the course of June and July, and I highlighted some of the preparatory things that they'll need to do as essential activities between now and then. And then DeVarty and HHBN also, just general preparedness for any other contingency response that may surface. Another development is we're going to have an influx of soldiers coming to Fort Campbell. Across DOD, there's some lifting of some of the travel restrictions, so soldiers that were in quarantine at their AIT locations will come via sterilized bus and/or a means of conveyance to get them here to Fort Campbell, where they don't require an immediate quarantine, and we'll get them in process and to their units as quickly as we can. And that'll be a couple hundred soldiers from all of the AIT locations coming to all of our units. Again, our priorities remain protecting the Fort Campbell team, and every decision we make and everything that we, course of action we adopt is with the advice and the professional opinions of our medical professionals included in all of that. And again, that'll be our highest priority going forward. So with that, Sergeant Major.
Sir, thank you. I think the point you made about the social distancing working is absolutely can't be emphasized enough. I think that's why we're at where we are, and we're not seeing a continued spike in cases. And so I want to thank everybody out there for observing the measures we put in place and also looking out for each other. The mission essential will continue, as General Winsky highlighted, with some of the training that has to happen for some of the upcoming deployments. And so it'll change from day to day for who's mission essential as we continue to go through this, as we've said all along. But it's important that people understand also that accountability is mission essential, and so we will continue to have lower echelons at the company platoon getting accountability of their formation of their formations. And when I say formation, I'm not talking about standing shoulder to shoulder in a formation, but that element. So don't confuse accountability with not adherence to social distancing. And I also want to highlight a few things that have been going on with some of the opportunities that have come out of this with online training. Great opportunity for soldiers to get caught up on their distance learning curriculum to enable them to get promoted to that next rank or grade. And also tuition assistance is still available out there for soldiers to take advantage of to further their civilian education or certifications as well. But thanks for what everybody's doing out there in regards to social distancing. Again, I can't emphasize that enough. We've had some cases that across other installations where a basketball game, a group of soldiers occurred, and all the soldiers got diagnosed with COVID. Parties on post, off post, where one person shows up that traveled out of state, and everybody ends up getting infected. Those are how the ways that this virus is going to be able to have its biggest impact is by not adhering to the measures we put in place. So I can't stress it enough that keep the circle small and that you interact with, and keep your distance.
Great, thanks, CSM. We'll throw it over to Patrick Birchfield. He's going to give some opening remarks on what's changed on BOC's posture. And then just some helpful subjects that you might be interested. So over to you, Patrick.
Thanks, Colonel Bell. The first thing I would like to do is start off by echoing what the Commanding General and the Division Command Sergeant Major said about thanking the people in the communities in and around Fort Campbell for doing the right thing. Largely, doing the proper social distancing measures has allowed us to keep the curve down, flattened curve and extended. We don't have a huge amount of cases, and that's because people are doing the right things in general. And that's the kind of behavior I want to reward and say thank you. So the biggest thing that folks will notice as a change around BOC right now is that our tent, our COVID drive-through clinic screening tent, is gone. It served a great purpose and valiantly. And even though it had literally over a ton of weights holding it down, one of those windy nights decided to carry away. And so what we've done in the short term is we've moved the COVID screening clinic into the C entrance. Now, when we first set up that tent, we were still having the C entrance open and people were coming and going, so we needed a separate place. Right now, as it stands, having the C entrance serve as the opening for the drive-through clinic is working nicely. That's not our long-term plan. We're looking at some other options, especially if, as we flatten the curve, if the curve extends and we need to look at COVID screening in people's cars in the long term, we're going to come up with some better options. But for now, if you call in and you get an appointment to come get screened or tested through the drive-through clinic, that's going to be at the hospital's C entrance. The doors will open, folks will come, you'll stay in your car. If you need to be seen extra, if you need to be examined a little bit more thoroughly, we can still get you into the clinic that is dedicated for COVID and segregated from the rest of the hospital so that we don't chance any spread of that disease. But it'll just look a little bit different until we decide to do something a little bit more permanent. But right now, that's the way it looks. There is, like the Commanding General said, an increase in the general positive cases in the local area. Again, the people that we've tested, and we found some positives, but the people that we found tested have done quite well. As the Commanding General mentioned, we did have an older patient that we decided to keep, and that was honestly a little bit more for our comfort or our discomfort than the patient's. he or she had a long history of lung disease, and so we wanted to make sure that as the disease progressed, the COVID disease, that they didn't turn bad like there's some media reports of happening, and our patient did not. Our patient did well and was discharged today. So it's a very good news story, and it mirrors the national trend of a lot of people have minor disease and they get better, even some of the older ones with high comorbidities. So that's a good news story. We know that practicing social distancing and having maybe more time with families crammed together than they're used to, or maybe if you're a single soldier and you don't get a lot of social interaction, or just the general change in your daily activities can be stressful. So we want to emphasize that this is a good time for you to show your strength as a soldier or a civilian or a community member, and beat that stress and be resilient, and remember some of that training you've had, some of that ready and resilient training, or the old battle mind, if you remember that, or maybe some MRT training, or even look at the performance triad stuff that's on the Army Medicine website. A lot of good activities there, a lot of things that you can do to keep your body, mind, and soul occupied so that stress, you can mitigate it. Another thing I want to emphasize is that BOC continues to do primary care, and even though that we've moved it all outside of the actual hospital and into the clinics, we're still doing behavioral health, we're doing women's health, we're doing children's well visits. I talked a little bit about that last time, and we're doing primary care in general. Now, where we can, we're moving those to virtual health encounters, either by the telephone or by an application that is sort of like Skype or FaceTime. It's actually Adobe Connect, the one that we're using, that allows you to see face-to-face. So if you have a rash you need looked at, there's actually a potential that you can get that done without coming in and having a virtual encounter. And then our providers can actually send medications to the pharmacy. You would pick up at that pharmacy that you would go to if you went to Bird. You'd pick up at the Bird pharmacy, etc. So we're really trying to increase the number of our providers that have that skill set to do the video teleconferencing. And we think that's actually the wave of the future. If we end up treating COVID and taking precautions for COVID over a number of months, we think that this is going to be the wave of the future. And so we really encourage our patients to get on board and try to do that. The ones that we've done so far have been very, very pleased with the results. So that's cool. So one other thing that we want to look at is stricter social distancing if you're pregnant. So if you're pregnant starting at about 37 weeks, we want you to be as strict as you can with your social distancing. That decreases your own risk, your baby's risk, and then the risk of our staff as well. Or if you have a known procedure like a C-section, 2 weeks before that, of course, that's the time that the virus would take to show itself. 2 weeks before that, we would ask that you are able to do strict social distancing, almost quarantine-like if you can. And of course, we ask that you continue to follow both the commanding generals, both governors, and the Secretary of Defense's advice with regard to social distancing. Wear a mask if you can't do the social distancing, and just take general precautions. The same stuff that your mom taught you: wash your hands, don't pick at your face, all of that stuff, that's going to keep you safe and healthy. I did want to highlight the lab results. The timeline we started, it was taking over 12 days, like the commanding general said. It's down to about two and some change days. Very impressed with that. We're getting great results. Some pretty savvy internet followers asked if we had antibody testing. We don't currently have that. There is some projection that we'll get in-house testing in the future. It hasn't happened yet. The way it's working right now, we're going to believe it when we actually have it, and we're running tests. That hasn't happened yet, but it will come down the road, and of course I'll let you know when that does happen. Looking at the projections for the peak of the curve, there's so many projections, there are so many models. You can find models almost like hurricane projections. You can find a model that'll show somewhere in the middle of April, where we are now, all the way out to July or even August. So the bottom line is we've had good success taking the social distancing measures that our community has been supportive of. And I would just ask that folks do not become complacent and continue to go ahead and do what's right. That's all I have, sir. Back to you.
Thanks, Patrick. Great intro. So I think for the first topic, this was a holdover from last week. We talked a lot about masks. we talked a little bit about what the policy was, what the standards was. So a couple more questions on that. So maybe we just highlight what we went over already. So if you could talk a little bit about the policy, and then CSM, if you could talk a little bit about the standards for masks.
Yeah.
Go ahead, sir.
So encouraged, encouraged everywhere, every setting, and Sergeant Major will talk through the update in terms of what's authorized, what's not, what's most effective, what's not. But it's required in settings where you cannot maintain that 6 foot interval. So in terms of soldier activities, that's pretty common when they're conducting maintenance, where they're in the engine bay of a Humvee or on a rotor head of a helicopter and working with heavy stuff that requires 2, 3, 4 soldiers to be in close proximity. And we're seeing that across the division with good effect. The Defense Commissary entity kind of mandated that all commissaries across DOD, it's required in there for not just the workforce in the commissary, but all patrons as well. I know that's a fairly recent change, really since this past week, but it's a requirement, and the density of people in the commissaries is generally a higher density than you have in the PX or some of the other things where we've not yet mandated use of the mask. The thing I'd emphasize again is understand the purpose of the mask is to prevent, if you're carrying it and you're not symptomatic, you don't realize it, it's preventing you from spreading it. That's the idea. So the mask is not a filtering system that keeps the COVID away and out of your body. It's more to keep it, if it's in your body, from spreading. So that's the purpose. Sergeant Major?
Yes, sir. I think it's also important to mention too that with the masks that it's something you want to wash every day if you're using a cloth mask, or if it's a disposable one, throw it away each day. And limit the amount of times that you're putting your hands in contact with that mask, because each time you do, if you have a mask on, if you're touching it and then touching a common surface like a doorway or something like that, you're really defeating the purpose of wearing the mask. So just because you're wearing a mask does not mean you're not able to communicate the disease. You have to still wash your hands and do all those other measures that we put in place. And also obeying good social distancing is good. It's just a way to reduce the rate of transmission. It's not going to solve this problem for us. Now, there's been a lot of discussion too as far as the regulations and what we're allowing for masks. And I'll tell you, we put out on social media last week a good one pager that shows what's acceptable for the mask. But ideally, if it's a self-produced one, you take a PT shirt or a tan T-shirt. And there's a lot of things on the CDC website on how you can create a mask without having to do any sewing. You just cut it up, make a few cuts, and then you have a mask that you can use. And then make a couple of them so you can wash one day and then have a fresh one for the next day and rotate them. We're also looking at procuring masks through the supply system. Obviously, there's a big demand for these masks as well. But if you're issued a mask from such as whether it's tan, white, blue, or some of the common colors that are out there, if your chain of command is providing you that mask, it's free to wear it to prevent the spread of the disease. So that's kind of where we're at, and we might have to get some strange colors up front based off of what's available. There might be some purples and blues and pinks out there initially until we can get some good ones. But the idea is to prevent the spread of disease. And but don't go. What's not authorized is anything that has writing on it, any patterns. Some of the exercise masks that some people would wear prior to this, those aren't suitable and they're not authorized for this.
Great, and you mentioned supply and masks, and some folks on the commentary are asking, why isn't the commissary providing masks? And simply, there's just not enough inventory.
They're not out there.
The inventory that's out there is really provided for the medical professionals. So that's why we ask that everybody bring your mask onto the installation if you're going to use a facility. Patrick, I'm going to throw it over to you for a second. 2 questions really. One related to masks, and that is, what's the proper wear for a mask, and what are the different types out there? But then Haley had a question on rapid testing for the COVID virus. If you can touch on those 2 topics, please.
Sure. Okay, great. So with regard to masks, there's all kinds of stuff out there about masks. The types of masks are kind of those homemade, you bring it yourself masks. That's a cloth mask, and that's proper for wear outside, anywhere you are. The surgical masks really need to be reserved for medical people doing medical things in a medical facility. And then the N95 mask is the famous mask du jour these days, and that's the one that's appropriate if you're doing an aerosolizing procedure or a procedure that makes a lot of really small particles that could be breathed in easily. And that's only going to be, medical procedures. So only medical people would wear those doing very certain procedures. So the cloth mask that the Sergeant Major just described making is appropriate for pretty much any situation unless you're a medical provider. And with regard to Haley's question, and the way you want to wear that, I'm sorry, I almost skipped that over. You want to make sure it's close against your nose, and it covers your cheeks and your chin. So you've got all of those mucous membranes covered there, your nose and your mouth. And again, we're talking about droplet spread unless you're doing one of those medical procedures. And so it's droplets that are stopped by that mask. So of course you want to cover your nose and your mouth. And then you don't want to have a lot of airflow around the edges. You want to have, you should be able to breathe through it, and it shouldn't stop you from breathing, but it should also not just billow, or else it defeats the purpose. And of course, you don't want to put a mask on anybody that's under 2 years of age, or anybody that's incapacitated, or anybody that can't remove the mask on their own, or anybody that's a choking hazard or anything like that. Haley's question was about rapid testing, and so that's in the to be determined category. We're looking at getting some in-house testing that will allow us to do some pretty rapid tests. Right now we have, for instance, one machine. There's a brand name of machine that we have in the lab, and but what happens is it takes the chemicals to run that machine, right? So the chemicals that run that machine, they're called reagents. They got diverted to a different mission, right? Because you can imagine right now we're not a hot spot. There are hot spots. You can just watch the news and know where those are. And so those reagents that help people test in a more rapid fashion have gone to more priority places. We do expect to get those. In time we will. But again, since we're not a priority, we're going to believe it when we actually have the stuff. But it's coming. It's coming.
Great. Thanks, Patrick. So before we kind of get into some of the other topics, Dodea was the next one that we were going to go over. Marlise and Leanne had an interesting comment, and they're saying that the president's considering opening up the country again. And so I was wondering, sir, if you could talk a little bit about the stop move, how much longer you think that's going to, and then how we align our decision-making with the outside community.
Yeah, so for schools specifically, we're going to stay generally aligned with Montgomery County and Christian County schools. And honestly, I'm even though we haven't formally declared that schools will not resume, I cannot see any significant change in the circumstances that would trigger resumption of classes right at the twilight of this semester. So, the spring semester is pretty much done. It's going to be virtual learning, for middle school and up, and then we have to determine what we're going to do for commencement and all that sort of thing, and all that decision process is underway. The stop move that you mentioned, which DOD implemented until May 11th, I believe it was, that is going to be extended DOD-wide, likely to the mid to end of June timeframe. The SecDef's considering it. There was just an announcement that it will be extended. It's just not yet finalized as to exactly when the stop move will expire. What that means for, it impacts mainly a number of our folks that are in a PCS limbo. They ship their household goods, they were en route to the next duty station, and we're still here when the stop move started. We've had a couple of exceptional cases that we have exception to policies in the works for, but those are truly very unique, very exceptional cases. Again, the idea behind it all is to literally stop the movement and have this thing well suppressed before we resume movement and inadvertently start, an increase in cases again. So that's going to be forthcoming, and we'll probably know something in the next couple of days as to how long that'll extend. But back to the schools this semester, I do not anticipate, a very low probability that we'd have a significant change in the next couple of weeks that would trigger resumption of classes at this stage. With regard to, again, the commencement, I think like most universities across the nation, most high schools across the nation, the likely course of action at this stage is a virtual type event. Now, we on Post have a relatively small senior class, so we may be able to do some things where we're still, physically separated and make it as good of an event for those kids as we possibly can. I mentioned the PCS folks, and it's a relatively small number that we have, about I think 35 or 40 that were in that limbo. But again, as a reminder, for those that are ETSing, getting out of the Army, you'll proceed as planned with your terminal leave and ETS and make your transition to civilian life or continued service in the Guard Reserve. But that is not halted in any way. It was strictly the PCS moves.
Excellent. Anything to add, CSM?
Yeah, I just wanted the audience to know that when this isn't going to just turn off, and we're not going to turn all these moves on all at once. When this, as we start to relax the restrictions that have been put in place on the stop move, what I would anticipate is it's going to be by select groups, and it's going to be small groups up front to not overload the system. And it probably just like we're doing with key and essential personnel right now coming into work every day, it's going to be probably that same with the stop move. Those most key and essential billets that have to move will be the ones that move, but the routine moves are probably will probably be the last ones. So I just want our families to be prepared that it's going to be a while for a lot of these folks.
Great point. And so these are kind of one-eaches or one-off where the individual's case is very individual, right? So, and they're very specific. So what we're going to try to do is tee up, it won't be a live virtual town hall, but we're teeing up two town halls that we're going to pre-tape and then post. And that's going to be one on ready and resilient, and then the other is on all the personnel actions that we're talking through right now. And our hope is that you can tune into those and listen in, and then hopefully those at least answer some of the questions that are out there. So those are coming this week. So on Dodea, I'll just give a really brief update on what Dodea is doing. First and foremost, like you said, sir, they're going to continue the virtual learning for the foreseeable future. They listened to our feedback. They actually sent out a survey to our parents, and the feedback that came back, they implemented this week. They're reducing on-screen time for some of our students, more flexibility on the education side, reducing the number of subjects that they teach in a given day, and then daily standard instruction times. They're also making sure that teachers have the time to do office hours with their students. So if students are having issues, teachers have the flexibility to actually schedule some time. I will say that if individual students are having trouble with a subject, they can go to www.military.tutor.com and set up a tutoring session as well. So another great service there. Standardized testing is canceled for the year. The college boards, so this is the AP testing, is a go for this year, but for those students, they'll get specific instructions on how to do that. And then I will say, for re-registration next year, that is ongoing at www.dodea.edu/DORS. So absolutely plug into that website. We still do have the student meal program. That's a very popular program on the installation. To date, Dodea has provided over 16,000 meals. And they were looking at curtailing that and really bringing down the service because they couldn't man the sites. But we just recently had Soldier and ACS volunteers. So it's a good news story for sure. Dodea is absolutely looking at the virtual graduation, and we'll see what that looks like in the future. So let's move on to Barber Shops. And we talked about that earlier today, sir. I'll throw it over to you first and just kind of talk through the current policy.
Yeah, well, we kept them open, so they continue to serve our soldiers. But we, with all of the off-post barber shops generally closed, there's obviously much greater volume. So they've got a great system of distancing within the waiting area. All the barbers have gloves and PPE protection equipment. Goggles, glasses, mask, gloves, etc. So I'm very confident that they're doing it safely, and it's an important service that we continue. But we are going to limit it to active duty military only to bring down the number of patrons, so it's more manageable for them. And then, in the case of retirees, etc., another opportunity to limit those that may be a little more vulnerable to this thing into those tight areas, relatively tight areas.
Thanks, sir. CSM, anything on haircuts or the standard? I know you have the standard of haircuts, but anything else you want to put out to our soldiers?
That's right. So the standards continue to stay the same. Shaving every day, haircut standards out of AR 671 have not changed during this. So soldiers have their options. They can do it themselves and do it correctly, or they can go to a professional at the barber shop on post.
Excellent. So we'll go over to Bach really quick. There's a couple questions that have popped up, and this is about continuing service. So the MEB process is one of those that have popped up, and then the flight physicals. As folks start gearing up towards what's next, and when COVID starts ramping down, what are you doing as a hospital to continue those types of services?
Those are really good questions, and you can tell people are starting to look forward, and that's good. So with regard to MEB, understand that what people are really asking about is IDES. That's the Integrated Disability Evaluation System. In the the integrated part means that we're partners with the VA. So people that go through the disability evaluation system get their Army disability ratings in conjunction with their VA disability ratings. And that started years and years ago because the process was simply taking too long. So the process is a lot better right now. The problem with that is as we streamlined it, the VA does all of the physical exams. It's called a C&P exam, a compensation and pension exam. And what that does is allows for only one physical exam to be used to determine what the soldier's ratings will be in the end. The VA, based on the fact that that's a very up close and personal examination, has decided to stop doing those for now until either the COVID crisis passes or they've decided some ways to mitigate the danger that would come from being that up close and personal to patients when it's really not an urgent or emergent situation. Now, the good news is that Bach providers, the Pueblos, everything that we can do, we're doing it. So everything kind of to the left, if you will, of that C&P exam, it continues. So the narrative summaries, all of those kinds of things, those are happening right up until that C&P exam. And anybody who's already had that examination, everything that goes on in the PEB process that goes to San Antonio and some other places around the world, those things are all happening. So there's one stopping point. The Army doesn't control that right now, the VA does. I assure you they're looking hard at how they're going to mitigate that. They've even talked about surging the capability once they figure out how to mitigate it or if the danger's passed. So right now we're doing everything that we can at the local level. Things are happening, cases are moving forward, and more to follow when we have a little bit more definitive information on that. Now, with regard to the flight exams, I actually called the director of the Army Aeromedical Activity, or AMA, today at Fort Rucker to get the latest scoop. And what he said was that there are some ways to go ahead and take care of flight physicals for those aviators who already have a physical in the system. So what they would do is they would create a new physical in the system. The flight surgeon would talk to that aviator either in the phone or in person if it was appropriate, and they would be able to, I don't want to use the word extend, but they would be able to, for lack of a better word, extend that flight physical if there was no reason that there are no real change in that aviator's history. With regard to initial physicals, if someone was applying to go to flight school, those are generally not happening. But if you have any specific questions, I would encourage you to call your flight surgeon at your local clinic.
Great, thank you, Patrick. I think before we kind of go into good news stories, training seems to be on a couple people's minds. What's next on the horizon for training? What are we going to open back up? Is Air Assault School going to be opened up? Is the NCO Academy going to be opened up? Those are the kind of specific questions.
No, great questions. You know, our focus right now, as I said, is physical training, individual level training.
Yes, sir.
And then there's some leader development things going on as well, some professional military education pursuits that a lot of soldiers are taking advantage of. Some things like drill sergeant school, as an example, was supposed to start, there was a course that was supposed to start this week. They're actually doing the first phase virtually, so there's a lot of academic things that they're able to accomplish to take a bite out of the drill sergeant POI before they have to physically go down to Fort Jackson for that course. So that's largely what we've been doing. Now, maintaining our equipment is directly impacting all training that we're going to do and our fundamental readiness. So there's been a pretty solid focus on maintenance as well, and maintenance activity with our aircraft, our vehicles, our weapon systems, et cetera. Going forward, we'll probably have a heavy focus on maintenance for the next couple of weeks still. We've made tremendous strides there. And then, you know, again, depending on how, you know, contained everything related to COVID is, and if the conditions warrant it, we'll transition to, you know, probably more hands-on individual and small unit training, where right now it's distributed and essentially virtual. As I mentioned earlier, one of our aviation task forces deploys to Korea in just a couple of months, so they've got to be ready for that, and the lethality of those Apaches are critical. So we're going to do a gunnery, but we're going to do it in a manner where we don't have large concentrations of soldiers, you know, on the range, at the FARP, at the flight line, et cetera. We're going to minimize and distribute all of that as much as we possibly can, so those crews emerge still lethal, but with minimum exposure to each other to, again, keep the great results and effects that we've been having up to this point. Again, assuming we're on the downside of the curve here in the weeks ahead, you know, we will deploy 1st Brigade and 2nd Brigade to JRTC in August and September. So there's some training requirements that have to be fulfilled here at home station before then. So again, if this thing is contained and absolutely manageable, and we're on that down portion of the curve, we'll be able to resume fundamental tactical training, live fires, et cetera, in the June, maybe late June, July timeframe, which is right before they head down to Fort Polk.
Good, and it's always prudent to plan
Right.
like that's going to happen, because you can't
Well,
turn
yeah,
that stuff
you
on.
gotta line up a lot of resources to do it,
sure.
and ammunition and training area ranges, et cetera. So again, every decision we make in this regard is going to involve the input of the commanders and command sergeants major, and our medical professionals, and you know, again, our surgeon, our hospital commander,
Yes, sir.
and a good thorough assessment as to you know, the risk and benefit of everything that we do.
Excellent. Anything to add, CSM?
I just want to add that, you know, the NCO Academy is open. It's just through distance learning. We have over 200 soldiers currently enrolled in the basic leader course that kicked off this week. And we're going to continue that. And we're going to look to, as this continues, as we get the student to instructor ratio right, we're going to look to expand that to potentially get more students through these classes while we're going through this period. Since we do have to continue to create sergeants for our formation and for the Army. We talked about the drill sergeant course also going on, and we still have soldiers in Ranger School that have been down there. We got 12 that should be graduating the end of this month. So excited to get them back. And then we also, as far as the Air Assault School, again, it's going to be a measured approach to how we do this. You know, we stopped a class right in the middle of one of their phases. So as we open this back up, we'll you know, it's going to be smaller sizes, and then we'll grow it to where we're having, you know, there's 250, 280 student classes going through. But we're going to start small, be able to keep that distancing, but we'll just have to weigh the risks as we get there.
Absolutely. So you brought up online classes. We've also made that transition for CAO and CNO. Those are classes that our soldiers can take. The commanders and first sergeants course is another one of those. hazmat is another. So we've tried to take as many of our online courses and so our soldiers can take advantage of this time to increase readiness.
Yep.
So,
Right.
So Danny asked the question about AIT soldiers. I'll cover that really quick, Danny. So we're bringing in a large group of AIT soldiers, about 242 folks, and they're going to come from a variety of places around the United States. They've already been in a quarantine status, so they don't have to worry about, we don't have to worry about them. They have to worry about us. So when they come in, our CalSU will do everything they normally do to receive and process these soldiers. We've created a 2 to 3 day process for every soldier to go through. And where appropriate, they will absolutely be doing social distancing throughout this in-processing period, and then limiting the number of folks that are at each station, essentially, as they go through. Anything you want to add, sir, for AIT?
No, again, that was a decision that the Army made, again, with the advice of medical professionals at all of the installations that are losing the AIT students and all that are gaining it. And, these soldiers in some cases have been kind of in a holdover status for, close to a month or more. So it's time to, again, now that they've been quarantined where they're at, get them. So as an example, infantrymen at Fort Benning are going to get on a couple of tour buses and come directly up here and go right into CalSU. So they're not going to take leave en route or anything like that. Yes, so that quarantine's valid as it transfers from one clean spot, if you will, at Fort Benning, Fort Sill, Fort Jackson, wherever, to our in-processing, our replacement, CalSU replacement company, and then pushed out to their units as quickly as we can and get them situated in their permanent barracks and their permanent unit and start to get integrated.
Excellent. So a lot of good news stories out there. The installation is absolutely figuring out where the issues are, where we have problems, where we have gaps, and we're filling those gaps. And we're trying to solve problems as quickly as we possibly can. I'll highlight a few just to kind of start this segment off. So financial readiness for soldiers is continuing. AAR is providing support. That continues every week. MWR has stood up an MWR to go delivery system for food, and certainly encourage everybody to tap into that. It's a great resource and something that the CG wanted very early on, which is more choices for food on the installation. MWR has also provided 50 meals free for our quarantine and isolation population. They've done a craft fair, if you will. It's a drive-up craft fair. But they've given out 300 bags of crafts and Boy Scout popcorn to our population, and they're going to do that again this Friday. So a very popular program. And then they've also given out Easter bags to our quarantine and isolation population. So with that, sir, maybe I'll throw it over to you first. What have you been impressed with in Fort Campbell's response to the COVID crisis?
Yeah, I think I said this last week or the week before. I've served a lot of places in the Army. I served here quite a bit, and no place comes together as a team, as a family like Fort Campbell. And just seeing everyone focused on this, things like the volunteers that are helping distribute the school lunches, and the volunteers that are helping MWR and USO distribute things to our folks, especially those soldiers in quarantine.
That's right.
And whatnot. So, just again, no one rises to a challenge like Fort Campbell, the Fort Campbell family, and we're certainly seeing that with all things COVID. And as a result, I think that's why we have such a manageable number, and for those that we do have, they're all on a path to recovery. So
Yeah,
it's working.
Thanks, sir. CSM, anything on your end?
Sir, I think it's important to note, we're in the middle of the AER campaign season, despite the COVID epidemic that's breaking out. And you highlighted up front that AER has provided financial assistance to 37 of our families across the Fort Campbell installation, as they continue to do throughout the year. And in our campaign, 1st Brigade is really setting the bar high with what they've donated up to this point, with over $17,000 in donations from the brigade alone. So I ask everybody in the community if they would like to support our soldiers and their families that are facing these financial hardships. AER is a great resource to be able to do that.
Excellent. Yeah, thanks for that. Patrick, I'm going to throw it over to you. I think you have a couple things that you've been impressed with too.
Absolutely. So the first thing, without a doubt, has to be the unified response of the Fort Campbell community and the units on Fort Campbell coming together to create a medical response that makes sense. So if you look at the 160th and the 5th group and the division and Bach, how we've come together to create an expansion plan that makes sense and that will be absolutely beneficial, absolutely good enough to take care of any patients that we have. If the surge gets big, it's quite amazing. Everybody's come together with training, equipment, and personnel saying, how can I help? And so that if bad news happens, we're going to be prepared for it. And so the first good news story is the way that all the different units have come together to really take care of the community. The second good news story that I want to bring to your attention is our inpatient and primary care teams. So our community, based on just what I said, really should be quite proud of the Bach and the medical people that have come together to make that plan. So much so that I think in many cases we're ahead of medical response in other places. We actually were highlighted in the primary care newsletter that was sent out to all of Army Medicine, and it looked at our inpatient and primary care teams and their response to our expansion plan. And it's so novel and it's so forward thinking and it's so appropriate that we were highlighted to all of Army Medicine as an example to follow.
I'll emphasize a couple points of emphasis. Especially our collective hats are off to the medical teams across the installation, and certainly Blanchfield Army Community Hospital, but our medical units as well. I am absolutely confident that if this thing were to expand in a significant way, the way they've organized and prepared the physical facilities within Blanchfield, and then the contingencies that they've developed, and some of the things like consolidation of all our respirator capability and making sure that folks are trained in their use, is solving significant problems before they're even close to coming to the point where they arise. Again, we've yet, out of all the cases we've had today, no one's required a ventilator, to include the older retiree that was in the hospital here for a couple of days, never got to that point. But if we do absorb significant numbers, we've got significant capability based on how the medical team reorganized and has prepared, and that's what Colonel Birchfield was just talking about. Especially proud also of, I talked about the 531st. They had a very quick turn in terms of the execute order for them to go to New York, and them physically getting on aircraft and flying away was less than a 2-day period of time. And again, they are doing a phenomenal job in New York City, saving lives. And they're now responsible for hundreds of patients in what is now the largest hospital in the Department of Defense there at the Javits Center. Our sustainment brigade just sent a contingent out, as I had said earlier, to manage the logistics. Our medical professionals are the frontline soldiers of this fight, but like everything, it requires significant logistics to sustain it. And we got the best team possible out of the Lifeliners heading there for that now. And 3rd Brigade also, on very short notice, reinforced the security of the southern border, the southwest border, with close to 300 soldiers that deployed in very short notice and pushed down there last week, and are really bolstering what 3rd Brigade and Customs and Border Patrol are able to do in terms of keeping any potential migration of corona infected individuals north of the border, and then fundamentally securing the southern border as well. So everybody's had a part of getting all those folks ready and pushed out, and the way they did it and the rapid nature of the requirement that they fulfilled is just really nothing short of absolutely impressive.
Yeah, absolutely, sir. It was impressive to watch for sure, and just to see everybody coming together and the synergy that exists here at Fort Campbell. Like you said, nobody comes together like Fort Campbell. So I think that's a natural stopping point for us. We're getting a lot of repeat questions, and then a lot of very specific questions. And I would ask again, for those that have specific ready, resilient, or behavioral health questions, or for folks with very specific personnel questions, and that's either legal or G1 / personnel actions, we're going to post 2 Facebook Town Hall pre-taped forums for you by the end of the week. Absolutely hope that you tune into those. and kind of glean as much information as you can, and hopefully we'll be able to answer a lot of your questions. Sir, I think we'll end there. I'll go over to CSM first if you have any closing remarks, and then end with you, sir.
Sorry, just again want to say, it's the things that we're doing that has gotten us to the point that we are, in a relatively good shape at this point in the crisis. And it's important that we continue to take these measures to prevent this from getting worse. Because it's when we let our guard down and start getting complacent is when the bad things will start to happen.
Excellent.
Well, and, Sergeant Major hit it. We are in a good place, but this thing could turn, it could spike in a significant way in a really short period of time, as we know. So, again, the common thread to almost all of our active positive cases has been contact with someone who's traveled or travel. So that's why we've imposed these measures that we have, and again, it's had really, really good effect, and we're going to continue with these measures. And I just, again, applaud everyone's discipline and adherence to them. But as time goes on, it's just going to become more and more challenging. So you just have to stick with it and stay focused. And this thing will be behind us in the not too distant future. And again, I'm really proud of the Fort Campbell community and how we've come together throughout the course of this thing. And that's why we're in the good place, relatively good place that we are.
Excellent. So answer a lot of questions. What I'm seeing a lot in this town hall is that folks are sending a lot of well wishes, and thank you for that. Thanks for all the positive commentary. Thanks for a lot of the great questions that you've sent in. We had a lot of directors and units on this Facebook town hall answering your questions. If you didn't get a sufficient answer, come back up on the net. We will answer that question as specifically as we can for your case. And then we always post the town hall on Facebook, so you can always refer back to this taping later on. So thanks again for tuning in, and appreciate everyone's time.